Hey guys, it's Hink here. Today we're going to try to tackle a topic which is pretty tough. It's hard flaccid, and there's not a lot of great literature on it, but I'm going to do my best to give my spin on things and kind of explain things in the literature, and hopefully it'll help somebody out there that might be going through this. So let's get right into it, okay? And so to start, this is coming from a pretty brilliant review article. I wish it was longer, but it's titled Hard Flaccid Syndrome, the Current State of Knowledge. And what they did was compile all the medical literature that they could find and summarize it nicely. I advise anybody to read it. I'll include a link at the bottom of the video, and it just talks about the actual science, what we have, what the actual medical data and medical theories that we actually have, and kind of how they relate. So let's just get right into it, okay? To start, so what is it? Well, anybody that clicked on this video pretty much knows what hard flaccid is. It's basically a condition, usually after some sort of injury, where your flaccid penis becomes hard and almost like semi-erect even in the flaccid state. And so it can feel rubbery. You can also have some associated symptoms like some sensory changes. It can be numb. Things can feel different. You can have coldness at the glands. You can also experience things like decreased morning wood, weak erections, or even erections where when you do get hard, the glands, the head of the penis doesn't fill completely. And this can lead to psych conditions like anxiety, depression, and sometimes you can even have some other pelvic floor issues like urinary and bowel and bladder dysfunction. So who does it affect? Well, obviously it affects men. In this paper, they looked at primarily men between the late teens to early 70s. What we see is that this disproportionately affects men that are engaging in any sort of penis enlargement, which is kind of how I came across this. And so anything like extending, hanging, jelqing, pumping, all of those things can put you at risk of hard flaccid. You can also see this even with just things like aggressive masturbation, and there's been case reports of hard flaccid after masturbation, which is part of what this paper is based off of. And so before we can really go any further, we have to really take a deep dive into the anatomy to truly understand how this works. And so I'm going to put a picture up here, and you can see that this is a male pelvic floor. And so there's two muscles in particular, the ischiocavernous muscle and the bulbospongiosus muscle. They work on the sides of the penis and connect to the base of the penis. What the ischiocavernous muscle primarily does is it contracts and it supports an erection, but it helps to get blood from the base of the penis up into the distal penis. With the bulbospongiosus, it aids in that as well, but its primary function is more so like ejaculation. So like when you have an orgasm and you feel contractions down there and the actual semen is ejaculated, that's your bulbospongiosus muscle. Also, if you are urinating and you're trying to get the last drops of urine out and you kind of contract your pelvic floor, that's the bulbospongiosus muscle. The key thing is that during normal arousal, when you're getting aroused, those muscles actually lengthen and they allow more blood to pool into the area. And then once you begin to get erect and your other physiologic changes take place, once again, they help keep that blood into the penis and help maintain a firm erection. Very key point when you're dealing with this is the actual neurovascular anatomy. And so if you look on this next diagram here, you can actually see the path of the dorsal nerve of the penis, which actually goes through the bulbospongiosus muscle. So if you have dysfunction here, or if you have a muscle strain here, it can literally cause nerve dysfunction. Or if the nerve is damaged, it innervates this muscle and it can cause dysfunction that way. Another key thing that is really important and is not talked enough about in male anatomy is something that's called Alcock's canal. And you can see in that cross section there, it's important because it's this very narrow little area that travels underneath some of the bones in the pubic floor, and it contains the internal pudendal vein and artery and also the pudendal nerve. And so it is very susceptible to traumatic damage, especially things like repetitive traumatic events. And so some of these like different penile enlargement techniques can make you really prone to injury to this neurovascular bundle, which can cause hard flaccid in a nutshell. So now that we have discussed the anatomy, we can go into causes. And so there's many different causes, and there's a lot of speculation about some causes as well. And I'm going to try to address all of them as best I can. So the first one is basically just injury at the base of an erect penis. Okay, that's kind of the first and foremost that they talk about in this paper. When you injure the base of the penis, that's when, as you could see on some of those other anatomy pictures that I put up, you have your neurovascular bundle, including the dorsal nerve of the penis and some of the arteries and the veins that come up, especially the dorsal nerve up on top of the surface of the penis. And so it can be very prone to injury. And so you can injure the bulbourethral and the pudendal arteries, the pudendal and dorsal nerve of the penis, and you can cause these vascular and sensory changes that are responsible for the symptoms of hard flaccid. one of the things that I talked about more in depth, especially in my video about PDE inhibitors and why you might need them, is stretch injuries can occur very quickly. And so especially if you are masturbating, joking, even sex, when you have an immediate stretching of the tissue in that area, you can cause a stretch nerve injury. And they've studied this in rats, and I talked about that in one of the papers. And so when you are stretching that dorsal nerve of the penis, as you can see in this diagram, it comes right up superficially along the penis and it's prone to injury. And so when you damage that nerve, that can cause nerve dysfunction in the penis. It can cause sensory changes and also affect your ability to have an erection if you don't have the appropriate nerve signals to allow that smooth muscle to relax, fill with blood, and engorge. You'll also see on this kind of eagle eye view down of the penis, and you can see some of those neurovascular structures that I'm talking about that are right there at the base of the penis, susceptible to injury. So especially if you're using an extender, for example, for prolonged periods of time, and the base of the extender is pushing back on that area of the penis, you can have nerve injuries that way. And then a really huge component for this, which is pretty much indisputable, is pelvic floor dysfunction. The pelvic floor dysfunction, it can come from a lot of different things. If you don't have a traumatic event, it can just be your anatomy. It can due to poor posture and just imbalances in your muscles in the area, which we'll talk about later. But a big thing is that, so let's say that you injure your penis, you aggressively masturbate, and you feel like it's injured. That actually starts this pathway of what we call sympathetic innervation. And so sympathetic innervation means basically the signals that your brain is sending to your penis or your pelvic area or just your body in general. The sympathetic innervation is what we call the fight or flight. So if your body is sensing danger, it sends out those signals, and it is not conducive to erections. What you need is parasympathetic signaling, which is basically your what we call the rest and digest signals. That is conducive to an erection. And so if you injure your penis, you think you injured it, and then you start stressing about it, you're sending out these sympathetic signals, and those signals are sending signals to your muscles of your pelvic floor, and they're saying contract, contract, contract. And so when those muscles are contracted, especially the muscles like the ischiocavernosus and the bulbocavernosus and the bulbospongiosus muscle, they constrict around your penis. And as you see with some of the anatomy charts, you have the nerves and the arteries and the veins that go through these areas. And when they contract, you do not allow for blood flow to these areas, and you also partially obstruct the venous outflow. And so that, in a sense, is what also leads to these small, hard flaccid, is the combination of poor arterial blood, but you still have some venous obstruction in the area. And so that's another thing that can cause the symptoms of hard flaccid, okay? You can also have a injury to basically the smooth muscle. And so surprisingly, a lot of people don't know that your penis is basically full with smooth muscle. That's what like the chambers are full of. And so your smooth muscle relaxes, which allows basically blood to come in. And it's a very complicated pathway that involves both nerve signaling and nitric oxide release, and it's an entire pathway. And so if you damage either the nerve, which you've already discussed, or simply by, let's say that you are jelqing and you are putting all that pressure on the smooth muscle in the penis, and you actually injure the smooth muscle, you can actually lead to dysfunction, and you've damaged the endothelial lining in these areas. And so you do not properly release the nitric oxide. Because you can't release the nitric oxide, the vasculature cannot relax, and your penis stays constricted because it cannot fill with blood because of the injury that has occurred. And once again, because of that damage to the muscles in the pelvic floor, like the bulbospongiosus muscle, for example, you can have actually altered ejaculation. So I wouldn't advise you to try to masturbate or have sex if you think that this is going on, but you might notice that you have a very weak or not present ejaculation at all because of the damage to the pelvic floor muscles. And so this is a beautiful chart that they actually put up, which actually describes how you can have the traumatic injury that occurs at the base of the penis, and then you have damage to those neurovascular structures, and then it's this pathway where you have these vascular sensory changes, emotional distress, that sympathetic innervation. The pelvic floor muscles stay in this prolonged, what we call hypertonic state. If you actually look at the, Cleveland Clinic has a pretty nice article about basically a hypertonic pelvis. You don't have to have like nerve dysfunction or like CP to have a hypertonic pelvis. If your muscles stay in this prolonged contracted state, they're basically preventing adequate blood flow and even constricting the nerves in those areas. And so you can see how you can have this cycle of hard flaccid, which we're going to try to correct. Another thing that I haven't seen mentioned as much is actually there's something that's called Buck's fascia. I'll put up a picture of it here. But so you have your, you have your corpora, then you have your tunica albuginea, then out on top of that you actually have Buck's fascia. And so it's just a fascia. Like you can have fascial injuries to your skeletal muscle, you can have a fascial injury to the penis. When you have a fascial injury, that can actually cause the fascia to actually constrict down on top of the penis, and that can actually contribute to that small constricted state. The way Buck's fascia basically attaches on the more superior or the dorsal portion of your penis, so if you look down at your penis and that's the surface, the dorsal surface that you can see, the Buck's fascia actually inserts onto your lower abs, whereas on the posterior surface of the penis, it actually extends into your pelvic floor. And so if you have damaged Buck's fascia, sometimes you can even feel it in your lower abdominal area, and sometimes you can feel it in your pelvic floor as well. And so it's important that you try to reverse these injuries, because if you damage that fascia and it occurs chronically and repetitively, you can actually have scar development, and that can sometimes make this a more permanent thing. And so next, we're going to talk about workup. So what do you need to do? Well, I think the most important thing you need to do is to see a doctor. All doctors are not created equal, guys. And I would be willing to bet that maybe 70% of doctors have never even heard of hard flaccid because it doesn't come up in their day-to-day activity. I think it's important to do things like print out this paper that I've attached below and bring that into your doctor and say, I think I have hard flaccid. These are my symptoms. I did literature research and I found this paper which is consistent with the symptoms that I'm having. What do you think? Okay. Otherwise, they're going to say, it's in your head, you're fine, give you a prescription of Viagra or not, and kick you out the door. So it is important to be your own advocate and educate yourself, which obviously that's what you're doing because you're on this video right now. The doctor can also potentially rule out other things, other causes of, the symptoms that you might be having that you might not be aware of. That's, part of the reason why we go to medical school, guys. Another thing that they can do is a physical exam. And so, who knows, maybe they do an exam and find out that you have a plaque along your penis and you actually have Peyronie's disease and not hard flaccid at all. And then they can also order important tests, one of which would be an ultrasound, which I think is a great non-invasive test to get. It shows, if you get a Doppler, it can show blood flow in and blood flow out. There's also electromyography, where they can actually literally put like probes to the different pelvic floor muscles, and they can actually stimulate them and see if your pelvic floor is in a hypercontracted or hypertonic state. And then they could even do something like an MRI. And so especially if there's any kind of traumatic component to it, sometimes you can have compression of the nerve, especially at Alcock's canal, or even you can see nerve dysfunction maybe in your lumbar spine where your pudendal nerve comes off of your lower, like L5 and S1, and that might be actually what's causing your problems. A key thing to understand that there's a wide spectrum of injury from very mild symptoms to very, very severe symptoms. If you go into these blogs, it can be scary sometimes, but I've had hard flaccid and it's resolved in 7 days. Other people have had hard flaccid and it takes months to recover, and some people are still dealing with it years out. So there is a wide spectrum of severity. Now we need to talk about different treatments, okay? These aren't necessarily in any particular order, but I think the ones that occur earlier are a little bit more important. So the pelvic floor dysfunction is something that you need to get evaluated and you need to get corrected. And so I think one of the most important things you can do is actually pelvic floor stretching. There's something that's called your deep front line, and I'll put up a picture of it here, and it's basically how all the fascia and the muscles otherwise connect along the posterior surface of your body up in through your pelvic floor and into your spinal cord and even up into your neck. If your muscles are too tight, it can predispose you or put you at a higher risk of like hard flaccid occurring. And if you stretch out these muscles appropriately, it can help to relieve that tension and relieve some of those pelvic floor issues and get you more relief. And there's a great video, which I'll put a screenshot up here, which you can see. And it's basically involving standing, touching your toes, a butterfly stretch, different sort of glute stretches. And when I was having my issues, I did this video. It cured all of my issues. So it's a wonderful video. Highly advise you to check that out. I'll try to include a link to that below as well. Okay. Another thing is physical therapy. Kind of have 50-50 results. Half of my clients that I've coached, I've seen PT and it hasn't been helpful, and they've actually told them things that I would disagree with, like basically inserting probes and different things into the pelvic floor to try to cause a myofascial release and whatnot. And honestly, I think that made symptoms worse. And I even had a client that actually had resolution of his symptoms once he stopped doing that because it was causing chronic irritation by jamming a probe up into the area and trying to release that muscle tension. But in general, they can look at things like your posture, and they can teach you different stretches and different techniques to relieve the pelvic floor issues that you might be having. There's medications, and so you can get something like cyclobenzaprine or Flexeril. It is a muscle relaxant. It can cause muscle relaxation. You can get PDE5 inhibitors. If you haven't seen my video on all the benefits of PDE5 inhibitors and how it can prevent fibrosis and smooth muscle atrophy and even apoptosis or cell death, I would highly advise you to do that, but that can be very helpful. And even something like ibuprofen, especially if you're having pain and inflammation in that area, it can help to resolve some of those symptoms. There's supplements. You want to increase blood flow to the area. Healthy blood is what you need to help you recover, okay? That's why you need a PDE5 inhibitor, potentially. And supplements like citrulline, arginine, or even beetroot can help with that. There's a huge psychological component, okay? So just talking to your doctor about the depression that you might be having as a result of the anxiety, part of that is triggering, once again, those sympathetic signals which are causing the problem in the first place. And so if it's appropriate, they can prescribe you an anti-anxiety medication or even an antidepressant. If that feels like a little bit too strong, there is a supplement called ashwagandha. It's been proven to improve your mood and decrease rates of depression and even increase testosterone, actually. It can cause liver damage in too high amounts, so be careful, and also some kind of dysfunction along your endocrine pathway. And so be careful with it, but especially if you're stressing the fudge out and you don't have access to medication, it might be something that's beneficial for you. Consider seeing this chiropractor. So I had a client that actually saw a chiropractor and diagnosed him with a leg length discrepancy. He was prescribed an insole for his shoe, pelvic floor symptoms resolved. That was what was causing his pelvic floor imbalance in the first place. So consider seeing a chiropractor. They can also do certain pelvic adjustments as well. Consider full body massages, okay? Even just massaging along those posterior chain muscles could potentially cause some relaxation and decrease in tension in that area and help resolve your issues. Reverse Kegels. This is a key one. I preach reverse Kegels. And so for those that don't know, basically reverse Kegel is really just a relaxation exercise. It's being cognizant of your pelvic floor and just being aware that there might be tension there and just relaxing that tension, okay? In its like truest form, you're supposed to kind of like extend your abdomen and you can actually feel your pelvic floor like sink down. So imagine that you're going to urinate and you're trying to start your stream and you relax those pelvic floor muscles and like literally the bottom of your pelvis should drop down a little bit. That's a reverse Kegel. So if you can practice, most importantly, just being aware of the tension in there and stop constricting your pelvic floor muscle, that can help you resolve, but also doing actively reverse Kegeling can help resolve as well. This is something you might not want to hear, but I would avoid sex and masturbation for at least a month or until your symptoms resolve, okay? If you have dysfunction, damage, inflammation along the nerves, and you are constricting those pelvic floor muscles, it's going to make your symptoms worse. And so I know guys that basically continually try to masturbate and stimulate themselves to see if they can get an erection, and it's just causing worsening cycle. So, in this case, I would say the only thing you should use your penis for is to urinate. That's it, okay? At least until your symptoms improve. You really need to get your health together, okay? You need to get cardiovascular exercise in, get your heart pumping so it's adequately sending the blood flow where it needs to go. But even things like healthy eating, when you eat foods that are high in fat, high in salt, you can have things like hypertension and actually plaque developing along the arteries that is going to make your endothelial function worse and lead to worsened problems, okay? Hydration, this is a very key for multiple different reasons, okay? The first one is that when you are dehydrated, your body sends out a signal called angiotensin. Angiotensin causes your blood vessels to constrict to make sure that blood is still going to your heart, still going to your brain, but it constricts the smaller vessels that are in the penis. So if blood flow is an issue and then you constrict that via signaling angiotensin, it's going to make your symptoms worse. So the only way to prevent that is from, taking an angiotensin receptor blocker or an ARB, but most importantly, just being hydrated, okay? So along with that, you also have your fascia. So a key component of the fascia is it's actually these like pockets of fluid, believe it or not. And so if you are dehydrated, you don't have adequate fluid in your fascia, and it can get sticky and it can get brittle, and that can cause fascial dysfunction and worsen that constriction and the pain that you're having and eventually scar down. And so the increased blood volume by being hydrated, the more blood flow goes to the area as well. So it's very important to be hydrated, okay? One of the most important things that you can do. Stop masturbating, we talked about that. Minimize any kind of arousal, okay? There is also something that's called the P shot, okay? Google it. I made a video on it previously. It can actually be helpful, especially in injuries, because it sends a lot of health and recovery signals and growth factors to that area, which can actually help you recover from this, okay? It wouldn't be the first thing that I would consider, but down the line, if you're not having improvement, it is something to consider, okay? Things to avoid. Kegels. For the love of Christ, please stop Kegling. Guys, I can't believe that guys are still Kegling. Stop Kegling. Even if you don't have hard flaccid, stop Kegling. You do enough Kegling when you use the bathroom, when you have sex, when you masturbate, even when you're not thinking about it, you're doing Kegels. You don't need to Kegel, okay? That being said, Kegels are gonna increase constriction on your pelvic floor, and it's gonna make everything worse. So stop Kegling, please. Avoid any kind of heavy lifting. When you do heavy lifting, it's gonna potentially cause those pelvic floor muscles to contract. It's gonna make things worse, okay? Avoid prolonged sitting. If you can, get a standing desk, okay? If you don't have access to a standing desk, just take a break every 20, 30 minutes, or at least every hour. Get up, walk around, stretch out a little bit, then come back to your desk. If you must, get some sort of padded seat that actually takes the pressure off of your pelvic floor. When you're seated, it can lead to weakening of your pelvic floor muscles, pelvic floor dysfunction and imbalance, and just a worsening of the pressure on the actual muscles of the pelvic floor, okay? Another thing to avoid is actually the hard flaccid blogs, okay? I know a lot of guys that think they have hard flaccid and they go on the blogs and all they can read about all of these guys that have had hard flaccid for their entire life and they're hopeless and they're thinking about harming themselves, okay? I would highly advise against that, okay? Go see a doctor, go see a professional, but avoid reading other people's horror stories, okay? Because people either report the very, very worst or the very, very best. And most of the guys that have recovered from this get the heck off the hard flaccid blogs, and so it's not an issue, and they don't post about, I had hard flaccid and I recovered from it. Some of them do, the good ones do, but not everybody does that. You have to avoid nicotine. And I know, if you have hard flaccid, it's gonna stress you the hell out, and nicotine helps with stress relief. Nicotine is a vasoconstrictor. If you haven't seen my video on nicotine and how it's killing your penis, you should watch that video, but you need to avoid that, okay? Bike riding. I know I said you need to do cardio, but there's actually an article in Nature, which I'll put up right here, that actually showed the differences in actual blood flow to the penis because of the seat's compression on the actual pelvic floor and things like the internal pudendal artery. And so avoid bike riding, do any other kind of cardio. And another thing is any kind of sort of physical manipulation of the penis. And so there's certain videos that you will come across on hard flaccid, and there's certain methods that involve constant and repetitive pressure on the dorsal nerve of not the dorsal nerve, but the dorsal vein of the penis, okay? That is going to make your symptoms worse. And there's certain videos out there that say it's actually from sinusoidal constriction around the outer rim, and I have no idea where that information is coming from. So I would highly advise you to not do any kind of physical stimulation like that. It's up to you, do your own research, that's just my opinion, okay? Other things to consider is just, once again, the position of your pelvis. And so there's something that's called pelvic tilt. And so if you have an anterior pelvis where it's almost like you're pushing your butt back, that can lead to chronic pelvic floor issues and pelvic floor dysfunction. And so an easy way to test for this is stand straight up to the best of your ability and then clench your butt cheeks, okay? If you notice that your pelvis is significantly moving forward, then you probably have an anterior pelvic tilt. This video is much longer than I want it to be, but hopefully it still helps somebody. If you need specific one-on-one coaching, I do offer that through my Patreon. You can reach me, it's Doc Hink.